has granted patent titled Process for the Preparation of Kunir Used in Siddha Medicine on 2024, the Patent Office, Government of India. Has participated as a delegate in the CME program on One Health. Let's collaborate to take care of our health, organized at AIMS Jodhpur on 2024. Has participated in training in good clinical practice, new drugs and clinical trial rules 2019 and ICMR National Ethical Guidelines organized by Research Section 8 Jodhpur on 2023. Your presence has significance to this special event, ma'am. Now I extend heartfelt welcome to our chief guest, Dr. Shailaja ma'am, for the presentation, Importance of Internal Medicine Used in Varma Maruthuvam. Thank you.
A pleasant good morning to one and all. I'm honored to be present here. As this CME program is particularly based on Varma, it gives me immense pleasure to give my insights regarding pharmacology, in which I belong to. I'm coming from the Gunapadam background from Siddha, and I feel very privileged to see all the faculties from all the medical colleges and also the AMOs here. Before starting going into it, I wish you all a happy Women's Day. I feel very great to give my presentation on this Women's Day, coming a long way from Jodhpur to my native in Tamil Nadu here. And today I'm going to discuss about mainly about the Varma medicines. So this CME program, it started since Monday. So this is the last day. So last day, and from day one you have been exposed to what's the history, how it evoluted, and what are all the basic specialities in Varma related with the fracture management and related with the neurological diseases. I carried all these things. So when you go into all these things, the basic thing which forms an indispensable part of the Varma literature are the medicines. So from day one, you would have been exposed to the stimulation. So how we can manipulate the Varma, what are all the techniques we can advocate by stimulating each Varma point, and by what are all the adangal which can be given, and what are the emergency management which would have been come across all these days. So whatever the stimulation we give, when you go into the literature, the basic thing will be the medicines. Okay? So in that, it's great, like the Department of Varma Maruthuvam has taken the initiative to give an importance to the Varma medicines also, though it is and nowadays you see Varma is mushrooming like anything, like how yoga grown as a corporate thing nowadays. Varma also everyone are taking in their hand, and it is focused only as a point stimulation manner. And as I am from AIMS Jodhpur, so here in Tamil Nadu, everyone knows Siddha. We don't want to explain what Siddha is. But since past 2.5 years, I have been associated with AIMS Jodhpur in Rajasthan. So Rajasthan is totally, they are unaware about Siddha. So then how come Varma? They totally doesn't know it. When you say Siddha, they'll ask, in turn they'll ask, is it Ayurveda? In that way. So with that thing in the notion also, so but I have been practicing Varma in AIMS Jodhpur. So the main thing is, more than the stimulations, Varma medicines are also important. So moving on. So what we know, Varma therapy is how we when we are addressing Varma, how we will explain to the patient or to our colleagues. We'll say it is non-pharmacological, right? It doesn't require medicines. It's a non-pharmacological, cost-effective, convenient therapeutic modality which can be done easily with your bare hands without any much effort. The only thing which you require is efficacy in your hand. You need that technical proficiency before touching the patient. So it is more a non-pharmacological one. But is it non-pharmacological? The answer is no. Varmam includes both the things. So it is not like it is completely non-pharmacological. So whether Varmam medicines are necessary, so what do you say? So medicines are necessary. So why it is necessary? Because when you go to any literature, you read any literature in Varmam. So what it will be given, like whether it is Varma Mudivu Sarasutram, Sari Sutram, Birangi, Varma Kannadi, Varma Chudamani, whatever the literature you go into it, how it will be given, the songs will be started with the Kapu and they will be focusing on either traumatic management or whether it was of fracture management or whether it will be nerve injury. So when you go into the literature, how it will be given, the first thing, what will be the impact of the trauma, like this will happen, that will happen, what are all the symptomatology will be given, and following the symptoms, what kind of stimulation you can give as the immediate management. That comes under the role of Varmam stimulation. If any Varmam is affected, so it has to be corrected with the Kaibagam and Saibagam method. So it is the role of the stimulation which we generally, for that, just the book knowledge will not be enough, which also require Gurukulam education. Then, so what we will be doing, she has given, Dr. Mena has given me a nice introduction about me. So I come from, I basically belong to Kanyakumari district. And so I'm, though I was brought up in Chennai, we usually visit Nagarkoil often. When I was a kid, often we used to visit the place. So because kids growing in Chennai, you will never hear about Varmam. I'm saying some 20-30 years ago, no one knows what is Varmam in Chennai. But in Kanyakumari, Tirunelveli and Thoothukudi, when you go, when any hit is there on a person, definitely all the family members or any common people will also say, என்ன சொல்லுவாங்கன்னா வர்மத்துல அடிபட்டிருக்கு, வர்மத்துல அடி, ஒரு சின்ன ஒரு அடி இருந்தா கூட, ஒரு எங்க அம்மாவே சொல்லுவாங்க, கணத்துல அடிச்சோம் அப்படின்னா கணத்துல அடிக்க கூடாது, ஏன்னா இங்க வர்மத்துல, ஸோ வர்மத்துல அடிபட்டுடும். இந்த ஒரு பேசிக்கான அந்த டெக்னிக்கல் டேர்ம் வந்து கன்னியாகுமரி மக்கள் கிட்ட நார்மலாவே உள்ள டெர்மினாலஜி. ஸோ காமன் மேனா ஒருத்தவங்க கிட்ட நீங்க போய் அங்க கன்னியாகுமரி மாவட்டத்துல கேட்டீங்கன்னா வர்மம்னா என்னன்னு கேட்டா அது அடிக்கிறதுக்கு உரியதுதான் அப்படின்னு சொல்லுவாங்க. ஏன்னா அடிச்சு அதுக்குள்ள இம்பாக்ட் என்னவோ அதை தான் வந்து வர்ம நூல்கள்ல வந்து நமக்கு ஃபுல்லா சொல்லியிருப்பாங்க. ஸோ வர்ம அடின்றது வந்து இட்ஸ் அ வெரி காமன் திங் விச் இஸ் நோன் இன் சதர்ன் பார்ட்ஸ் ஆஃப் தமிழ்நாடு அண்ட் சதர்ன் பார்ட்ஸ் ஆஃப் கேரளா. ப்ரீவியஸ்லி கேரளா, சதர்ன் கேரளா இஸ் அ பார்ட் ஆஃப் டிராவன்கோர். ஸோ இங்க பாத்தீங்கன்னா கொல்லம், ட்ரிவாண்ட்ரம், கன்னியாகுமரி. ஸோ இந்த 3 டிஸ்ட்ரிக்ட்ல தான் இன்னைக்கும் வர்மம் வந்து ரொம்ப லைவான ஸ்டேட்டஸ்ல எப்படி பிராக்டிக்கலா மக்கள் கிட்ட போகணுமோ உண்மையான வர்மமா வந்து இன்னைக்கும் நிலைச்சு இருக்குது. ஸோ என்ன பண்ணுவாங்கன்னா, if anybody is get any kind of injury, what they will do, they go to a asana. So each and every family will know one or the other asana, and all the family members will also, yaradhu ortharadu will have that varmam knowledge inside that family. So what they will do, they will go to asana, they will take that person. What the asana will do, he will stimulate certain varmam. So colloquially it is said like தடவுமுறை. So what என்ன சொல்லுவாங்க, எண்ணெய் போட்டு தடவுனாங்க அப்படின்னு சொல்லுவாங்க. So they will just stimulate with certain certain varmam points and with தடவல் முறைகள். And what they will give some medicines. They will give medicines according to acute or chronic. I said I come from Kanyakumari. I heard about my tata. He is from Kanyakumari, Sri Krishna Perumal, belonging to Kesavam Budura. So what they will say, மரத்துல இருந்து கீழே விழுந்த உடனே எங்க தாத்தா கிட்ட கொண்டு வருவாங்க. ஸோ அவர் வந்து கை வச்சு கட்டிட்டு அதுக்கு பிறகு மருந்துகள் வந்து உள்ள கொடுப்பாங்க. ஸோ இட் இஸ் அ வெரி காமன் திங். ஸோ ஒன்ஸ் தே வில் கிவ் வர்மம் ஸ்டிமுலேஷன், Then followed by that, some medicines will be given. So very commonly known medicine is Kaya Tirumeni Thailam. Kaya Tirumeni Thailam, which is very commonly known in Varma, and usual common people also know this. So first I said what is the common man view about the Varmam and the Varmam medicines. Now when we go into the literature, so professionally we will be reading lot of Varmam literature. So we all know most of the Varmam, almost every Varmam literatures are in Tamil language, few are in Malayalam, but when you read that literature, the script will be in Malayalam, but it gives the meaning in Tamil only. And there are certain literatures which have a script of Malayalama also. So predominantly Varmam literatures are based on Tamil language. And in all the literatures, most of them, how it is meant, I give a case study of an example, as an example. When you read Urpatti Narambarai, that is a Varmam literature, it will give the songs for all kinds of Nadi rules. So for example, when you see Singuvai Nadi, where the Singuvai Nadi, which starts at the navel point, it ascends up, goes into the chest cavity, comes to the clavicle, then collarbone, then again goes to the liver, and then comes to the symphysis meldi and to Kumbaga Mudichu. This is the normal route of, I'm saying the very basic route of Singuvai Nadi. Once the Singuvai Nadi is affected because of hit, for example, if a person falls from a tree and he got a hit on his low back, the sacrococcygeal region, so the Kumbaga Mudichu, that is the sacrococcygeal region, which have the hook of this Singuvai Nadi will get affected. So what will happen? Once that Singuvai Nadi is affected, patient will come with the hyperpigmentation in the body. So அவருக்கு என்னன்னா கீழே தான் விழுந்திருப்பாரு, அடி வந்து நமக்கு லோ பேக்ல தான் பட்டிருக்கும், பட் சிம்டம் என்னன்னு பார்த்தீங்கன்னா he will have dyspnea, and also long-term problem will be hyperpigmentation in the body. So when you read the literature, the flow of the literature will be, first the symptoms will be given, followed by that what will be given, what you have to do as an emergency management. So if Singuvai Nadi is affected, the emergency management which is said in the literature is Annakala Melthare. So Annakala Melthare is nothing but it lies on the stomach. So even it is said that you have to அதாவது கையில வந்து ஒரு துணியை வச்சு டைரக்டா you should not apply Annakalam. So I think you all would have known when you are touching the navel, because navel contains it has relation with 36 adangal. So just like that, you should not touch the navel point. When you are touching inside the navel, you have to have a kind of cloth in your hand, then only you have to touch the Annakalam, that is any kind of navel point. This has been given in the literature. So when you go to when you have the Gurukulam based thing, I had my Gurukulam based education from Shanmugam Asan. From my college days, I have been his student. He is my ardent teacher. So these small things you will get to know only when you are learning this Varmam with the asans. So when you are touching that Annakalam, that energy of the Singuvai Nadi will get corrected. So this has been mentioned. Then what will they say? So the Varmam stimulation will be mentioned. Followed by that, it will be given a long list of medicines. Whatever the literature you see, it will have a long list of medicines. What external medicine to be given, what internal medicines to be given. So in order to correct the Singuvai Nadi, you have to apply that Annakala Melthare. I think not to become boredom, I can just tell you how we can apply that Annakala Melthare. Any one volunteer can come forward. I think any gents side anyone can come. So Singuvai Nadi, it forms the basis for the speech. Yes, Singuvai basis for the speech. And so as I said, any Varma, when you go, I'm just telling what will be the flow of things in a Varmam classical literature. So for example, if Singuvai Nadi, when it is affected, it's a very simply I'm going to apply. What they will be saying, Annakala Melthare should be given. So, but this Annakalam, when you are touching inside the navel, you should not touch with your bare hand because Varma is basically the energy-based system. So, when you are applying, how you will, so you have to locate the navel. So, when you are locating the navel, you have to give your middle finger. Just you can touch inside it and lift upward. This is the application for Annakala nail tare. So this it is given in the literature. If Singuvai Nadi is affected, once you are applying this Annakala nail tare, this Nadi root gets relieved. But is that the end of the treatment? No. If that is the end of the treatment, why the medicines have been enlisted? There is a huge list of medicines enlisted in all the literature. I'll tell you how many literatures are there. So you can give this Varma point in sitting posture and as well as in lying posture. So what first you have to locate the navel. You have to give your middle finger. So you have to just you have to take care. You should not harm the navel. Okay. Just you have to give your one hand into it and you have to lift upward. This is the application for Annakala Melthare. And this Annakala Melthare, it not only normalizes the Singuvai Nadi, it enhances the speech also. Thank you, sir. And so, as I said, this Varmam stimulation, then followed by that some decoction, kashayam, kudineer will be given. So, and then followed by that, because we have to take care of the Kumbaga Mudichu, right? Previously, I said with the fall, the Kumbaga Mudichu was affected, which had the link with Singuvai Nadi. So, what you have to do? You have to apply some oil on that Kumbaga Mudichu. What oil can be applied? It is also given in the literature. You can apply Vasavennai. So, in Varma, Vasavennai is more commonly used. Vasavennai, there are many preparations in many books. And when it comes to the specific things, you have to go, when you are going with the same, so for this nadi, this medicine, this nadi, this medicine, that will give more comprehensive approach of the management of such a disease. So, for example, Vasavennai can be applied for that. And in certain other things, there are certain internal medicines, not only decoction, Kaya Rajangam, Kaya Sarvangam, later on we will be saying. So this will be the flow of the literature, flow of the how the Siddhas has given in the writings. Okay. So here I have mentioned it can be case specific intervention. This is the case specific intervention, right? When you when you are reading extensively, you can get these matters from the books. So the example which I told is case specific intervention. Then common usage remedies. So in certain books, for example, in Odivu Murivu Jnanam, there is a book called Odivu Murivu Jnanam. So in that book, when you see, they will just list out all the symptomatology of trauma. That is fracture management, full almost more than half a part of the literature will just mention all the traumatic management. Finally, they will mention about the medicines like Taruna Rajangam, Kaya Rajangam, Payyara Thailam, Kukkudadi Kashayam, Vasavennai, Danu Mandrali. These are the very, very best medicines which can be used in your Varma practice. So all these medicines are mentioned at the last. So when you are reading a literature, you will get both the kinds of knowledge. So then coming about the Varmam literary treasure. So what I will say, it is a treasure because no other systems of medicine have these kind of unique preparations. Like in Siddha preparation, Varmam is a part of Siddha. But when you read the literatures of other Siddhas, you cannot find these kind of formulation in a regular our Siddha books. So this Varma literature, they basically belong to Western Ghats region of southern India, especially in Tamil Nadu and Kerala. So when you go to the, so everything will be in Tamil language, and we have done one work. In that we have collected some from some 120 titles of book, we were able to get 16,860 songs which just mention about the medicines. So there will be huge collection of other things also. Just it is from both published and unpublished literature. It contains this number of songs with just mentioning about the medicines. And the thing is how there are all these medicines, all this literary work, they require critical edition because there will be repetition of songs. So in there is Odivu Murivu Sarasutram 1200 and Odivu Murivu Sari Sutram. In both the things, when you are comparing, certain medicine, certain traumatological management will also be repeated. So it is our duty to decipher properly and we have to take out that repetition. So some unwanted things will also be there. So when you are taking out those things, finally we may have some 12,422 songs. So, so this is an extensive database for our Varma medicines. So I have just listed some classical literatures in which whatever I said previously, in that way the flow of literature will be there. Varma Chudamani 1500 Panchikarana Pinnan, then Varma Odivu Murivu Sarasutram, Varma Odivu Murivu Sari Sutram, Odivu Murivu Jnanam, Varma Kannadi, Urpatti Naramari, Varma Chutiram, Varma Uri Ayiram. And there is a literature called as Varma Kandam and Varma Sucham, Varma Suchadi Sucham. So these literatures gives the physiology of the body. What is the function of Varmam point? When you are stimulating the Varmam, how does it, what it does to the body? And if you are not stimulating also, what is the normal function the Varmam point does to the body? These things are mentioned in those literature, but it is unpublished. Coming to Varmam pharmacology. So when you are reading about the so in Siddha, generally the raw materials are based on herbs, metals and minerals, and also animal kingdom. But when you are reading extensively the Varmam literature, you can find the data like most of the Varmam preparations will be herbal based, okay, and it will be based on some animals. Very minimally minerals and metals will be used. It's very minimal, and that too it comes only when there are very huge preparations like Tanu Mandradi, Kaya Rajangam. There are certain mineral preparations used, but generally when you are giving an overview of Varmam medicines, most of the things will be in herbal origin. Then just I'm going to give an overview of the Varmam medicine. So that is when it comes to herbs, both flowering and non-flowering plants have been used for most of the preparation. Flowering, we know all dicots, monocots are used. Non-flowering, that is like iruvi, ferns. They have also been mentioned in Varmam literatures. When you are seeing very big oil preparations, those raw materials will be used. And most of the literatures, most of the herbs which generally grows in Western Ghats will be used because Western Ghats is one of the world's biodiversity hotspot. So throughout the year, you will be getting all the herbs in those areas because when you see other coastal other areas, certain herbs will not be available in certain seasons. But this will not be any Karuvilanji Kudam. Have you ever used Karuvilanji Kudam? So this Karuvilanji Kudam will not be in our Siddha literatures. When you see any of our Siddha books, this Karuvilanji Kudam will not be mentioned. Kurimindan. So Kurimindan, I think we have another name of Thelkodukku, but that is not the Kurimindan which is used in Kanyakumari. Okay? And Karunjura Patte, I think you would have heard about Karunjura Patta Thailam. You would have used in your practice also. It is good for neck pain and any kind of cough related problem in your neck. But this Karunjure Patte is also not much used in a regular Siddha preparations. Then Panjavan Kalkai, it is also not much used in a regular thing. And Kodutwa. Any guess about Kodutwa? But these Kodutwa, if you are speaking to a Kanyakumari people, they will say. Actually, Kodutwa is nothing but Kanjuri. I want to give an example, so I have mentioned. So everyone knows Kanjuri, Raja Involucrata. But But when you are going to if you want to make some preparation from Varmam book, without knowing what does it mean, how we will procure, you cannot get from the market also. And if you want to give us a fresh herb, only when you know its scientific term or when you know its normal Tamil term, then you can go with the preparation of the medicine. So here, that the knowledge of local dialect of Kanyakumari and Kerala is also important to decode preparations from Varmam literatures. So Karivilanji Kudam, I will explain later. Kurimindan is Oximum hirsutum. Okay. It's a kind of tulasi. I didn't get the picture. It's a Oximum hirsutum. It's a kind of tulasi variety belonging to Lamiaceae family. Then Karunjure Pattai, I'll show you. It's Panchavan Palkai. Panchavan Palkai is it's a Roderick preparation. So Mirai. Do you know Mirai? When you are seeing Varmam literatures, Varmam preparation, there will be Patira Pagam. In that, they will be giving Mirai, Kunglium, and Kasturi Koros. These things and all we will be knowing. This boiling of Mirai along with milk, that is called as Panjavan Padukai. This you will be getting in any Roderick shop in Kanyakumari. When you go to Gobalasan shop and you are asking, you need Panjavan Padukai, they can give you. But Panjavan Padukai, as a doctor, we should know what is Panjavan Padukai. As a raw material, you can get from the market. But Panjavan Padukai is nothing but boiling of Mirai along with milk. It will be made as a powder, and that will be added in most of the preparations. When you are preparing any kind of external oil, this Panjavan Padukai will be there. So just to get an understanding of the language importance, I have just listed out. So unique crops. I have said no Karivilanji Kudam. So Karivilanji Kudam, still I am not sure with its botanical name. It may be Diosphoria spicata. Okay, but this is very common in Kanyakumari and Kerala. Because in other areas, even I have never seen it. It grows in high altitude area. That is in Western Ghats, they have some kind of temperate condition where this Karivilanji Kudam grows. This Karivilanji Kudam will be having a very sharp spine, and its root will be used. When you see when you are seeing some 10 preparations, minimum 2 preparations will have this Karivilanji Kudam. This Karivilanji Kudam will also be available as a Roderick in Roderick shop. But this is its natural picture, and the collection of Karivilanji Kudam is very tiresome because it grows inside the crevices of rock. So once if you want to take the roots, because roots will be used in the medicine, if you want to take the root, you require a lot of effort, and definitely you will get one or the other blood markings when you are collecting this Karivilanji Kudam. And it will be added as a semi-solid decoction in the preparations. Then Kodutwa. Kodutwa is nothing but the type of kanjuri. There are 3: Sirukanjuri, Perunkanjuri, and Sendatti. So Sendatti is also a terminology for a kind of kanjuri which is seen in Kanyakumari. Sendatti will have red, the pedicel, the petiole of the leaf will be red in color. The same, what kanjuri will give? Anyone can answer to take a, what's the effect? Sir, ma'am? Any kanjuri, what is its use? காஞ்சரியோட யூஸ் என்ன? அப்ப காஞ்சரி வந்து மேல தடவுனா நமக்கு உடனே இச்சிங் வந்துடும். அதான் எனி கைண்ட் ஆஃப் காஞ்சரியோட ஆக்ஷனே வந்து மேல தடவுனா இச்சிங் வந்துடும். ஏன் கொஸ்டின் கேட்டா நிறைய பேருக்கு ஸோ காஞ்சரி வந்து நமக்கு தொடும் பொழுதே நமக்கு இச்சிங் வந்துடும். ஸோ அண்ட் இட் இஸ் யூஸ்ட் இன் ஆஸ்மா, மெயின் யூஸ் ஆன்டி அலர்ஜிக், for antihistaminic. So you can use mainly for asthma. So in that itself 3 varieties are there. The common terminology which is used is Kodutwa, Sendatti for Kanjuri. Triagia involucrata. Then this is Karunchurai. And this is Caparis setiaria. This Karunchurai will also have spines. So many of you would have used Karunchurai pattai, Thailam, for oil bath and also for neck pain. for any, because it works very good for cervical pain. But it is actually prepared from this herb only. And this will grow in little hot and dry areas also. The previous one, this Kalvilanji kuda, it grows in high altitude and little humid area. But this Karunjure can grow in hot and dry area also. In certain places, it is called as Puligori Mulige. Puligori Mulige. That is when you come to northern Tamil Nadu, it is called as Puligori Mulige. It is Puligori Mulige. It will decoction of the Puligori Mulige will be good for knee pain. Any kind of knee pain, knee sprains, you can just apply it externally. You have to make it as a decoction, and you can make paste with some of the herb, and you can apply externally for knee pain and knee sprain. Then next is any guess? Cleomonophila. You have seen the picture. Any guess? Correct, sir. So Cleome viscosa, we all know it will have yellow flower. Nama the nai kadugan solluvom. Then Cleome gynandra or Gynandropsis pentaphylla Tyvede. Tyvede is very commonly used in Varmam preparations. So this is a kind of, it also belongs to the Caparaceae family, and it's called as Cleomonophila. And in Kanyakumari, it's called as Tirumeni Mulige. So it also in certain Kaya Tirumeni preparations, this will be used. And when this will be commonly found in Penandopu. தென்னந்தோப்புக்குள்ள போனீங்கன்னா நிறைய செடிகள் இருக்கும்பொழுது இது வந்து வீடு மாதிரி வளர்ந்துருக்கும். And it is when it is grown in a nice way, and if the soil is rich in copper, it will give a glow like a peacock feather. So it is also called as mile peel. That also it is called. But in most of the literatures, it will be mentioned as Tirumeni Mulige. Okay, so this is this we generally will not use in our preparation. In Siddha preparation, we use Naikadugu and Tyvede. This is a different one, Cleomonophila. And you can see this in Coimbatore, some little moist places, it will naturally grow. In Mukkutti. How many of you seen this? Sir, முத்திருக்கு செவி இல்ல சார். இது வந்து it's a sensitive plant. It's a sensitive plant like like Mimosa pudica. This is a sensitive plant. But Mimosa pudica, it will have pink flowers. It will have pink flower, and it will be very, very sensitive. The other name, this is commonly called as Mukkutti. In the literature, it will be a Mukkutri. So Mukkutri, and most of the Kerala people know this. They make kanji out of it. So for Karkadaga kanji and Karkadaga month, Kerala people, they make some kanji just with all wild herbs. அதாவது நம்ம கண்ணில் பார்க்குறோம் இல்லையா, அருகம்புல், ட்ரைடாக்ஸ் ப்ரொக்யூமெண்ட்ஸ் எல்லாத்தையும் போட்டு ஒரு கஞ்சி வச்சு கர்க்கடக மாதம் குடிப்பாங்க. ஸோ அதில் வந்து திஸ் இஸ் த மெயின் இன்க்ரீடியன்ட். ஸோ இட்ஸ் ஆல்சோ கால்ட் அஸ் தொட்டாவாடி தீண்டானாடி. Totta chinungi is Mimosa pudica. This is Tottavadi or Tinda Nadi, and it is more used in mantra, tantra, and for vasyam purposes also. This mulige is used. It's called as Biophytum sensitavum. There are two varieties. Thus I have shown this yellow color. Picture is not clear. This yellow cover flower is also there, and one more variety of orange color. It will be very beautiful color. So it will be orangish red flowers will be there. This you can find in Kollimalai areas also. And it grows in November, because in Kollimalai areas, it will be very hot in coming months. Kollimalai area will be very hot. But when you are going in November, December, until this Masi month, you can see this in Kollimalai areas also. Okay, this is more used in Varmam preparations. And the other thing, Panappul. If you would have read the literature, these Panappul and all will be coming very often in the Varma Kashayangal. Because in Varmam, kashayams are very important. They form an indispensable base. So in that you will see this panappul. So panappul, this is very common. This you can see in our NIS campus also. This is very common, but we because its other name is Ramanama Pachile. See, there is one Namam kind of, no? So it's also called as Ramanama Pachile. It is very common, it is very wide. Only when we know it is very wide, then only we can use in our preparations. Otherwise, we'll think it's like some Greek and Latin and we cannot use it. So just to give that kind of view, I have put these pictures. So, when you see that Varmam preparations, there will be preparations containing more than 100 herbs also. There are preparations which contain just 2 or 3 herbs, 1 herb, and like 108 herbs. In that way, the preparation will be very huge. So, just I have listed what are the very, very common herbs which are mentioned in Varmam literatures. Thaiveli, that is Gynandropsis pentaphylla. Then Kuppaimeeli, Acalypha indica. Kuppaimeeli, there are 2 types of Kuppaimeeli. One is Kuppaimeeli, another one is Vattathirumeni. Have you heard of Vattathirumeni? So this Kuppaimeeli will be, the leaf will be little whorled, little rounded in shape. Vattathirumeni, the leaf will be little lanceolate and the margins will be serrated. Okay, so this because in the preparation there will be Kuppaimeeli also, then again Vattathirumeni also. So both forms, they are the different forms of Acalypha. Then Veliparuthi. Veliparuthi, we all know it is a very commonly used herb in Varmam preparations. And then Changan. Changan is Azaima tetracantha. So Changan, it is very commonly used in used as a powder. So Changan, the leaves will be dry and it will be mixed with rice flour, and it is given internally for quick healing of wounds and also for asthmatic problem. So it is very commonly used plant. Then Vettile. So we all know Vettile, piper beetle is also commonly used. Then Kutti Takali. Kutti Takali is, no, not Manatakali. It's Soduk Takali. Even this Kutti Takali will not be mentioned in our Siddha literatures. So this Manatakali is Solanum nigrum. This is Physalis minima. This is Physalis minima, which is very common. Everywhere, everyone knows it. But the thing is, it will be mentioned as Kutti Takali only. Not even Sodakku Takali will be mentioned as in literature. It will be mentioned as Kutti Takali. Then Devadaram in our order. This Devadaram, Punguliyam, Korosane, Kasturi, these things will be mentioned a lot. Then Kovai. Kovai is also, in most of the, there are many kinds of Kayathirumeni oil preparation. In most of the Kayathirumeni oil preparation, whatever the herbs I have mentioned, like Thaiveli, Kuppaimeeli, Kovai Ilai, Musumusikkai will be there. Then Musumusikkai, you all know, there is also mainly there. Then I have mentioned about Kanjiram. What is Kanjiram? Eti. So common terminology in Kanyakumari, people will not say as Eti, they will say as Kanjiram. So in most of the preparations, it will be written as Kanjiram only. So you can see Erichi Kanjiram, Vayal Kanjiram, and one more thing, Puri Kanjiram is also there. In the same preparation, all these things will be there. So all belonging to extremely different family, right? This Kanjiram, it belongs to Laganeaceae. Then Erichi Kanjiram is Mirahatandri. Mirahatandri. Miraharane, yes. Miraharane. Miraharane Verpattai. That is Todalia asiatica. So Erichi Kanjiram. How many of you have tasted Miraharane? Fresh leaf? It will give that karam, no sir. At last you will feel that spiciness like a thick like a long pepper. It will give that spiciness at the end. So by this property, the name has been given, but no literatures will, I have never seen like Miragarane direct way. It is mentioned as Erichi Kanjiram or Miragatandri. So when there is Miragatandri, it is commonly what we will make a mistake. We will take as Miragu as one drug and Tandri as another drug, right? when it is there as Milagatandri Verpattai, you have to take Milaharane Verpattai, not the pepper and the tanchikai. Okay. Then Vayal Kanjiram. Vayal Kanjiram is a herbaceous. This Kanjiram is a tree, Erichi Kanjiram is a shrub, and Vayal Kanjiram, Glynis oppositifolis, it is a herb which grows on the surface. Then Iruveli. Iruveli, how many of you have used or seen? Iruveli, there will be confusion. Iruveli, whether it is vetiver, whether it is the other name of vetiver. Vetiver is Vetiveria zizanioides. Iruveli is Plectranthus. It is a Plectranthus. That is our Vilamichande. We will say Vilamichande. No, that is Iruveli. So the leaves will be very similar to Navarapachilai. Karpuravalli. Navarapachili Karpuravalli irukkalingla. So Karpuravalli will have good aroma. Karpuravalli will, the leaf of Iruveli and Karpuravalli will be exactly the same. But when you this Karpuravalli will be having good aroma. Iruveli will not have any aroma. This will grow in little cool and humid areas. And it will have a dyeing agent called as dye, orange color dye. Previously, this herb was used to dye the dhotis. So, நம்ம வேஷ்டிகளுக்கெல்லாம் அந்த காலத்துல டைக்காக இந்த இலையெல்லாம் பயன்படுத்தினாங்க. ஸோ இது நம்ம மோகன்ராஜ் சார் இருந்தார் இல்லைங்களா? ஸோ மோகன்ராஜ் சார் வந்து இந்த இன்புட் கொடுத்தாரு. அந்த காலத்துல இந்த dyeing agent வந்து this has been used in olden days. So Iruveli will have a dye, and this Iruveli you can see in most of the preparations which is mentioned for pitta diseases. So like how vetiver is used in the similar way, but vetiver is totally different. It's a grass. This Iruveli will be mentioned in most of the preparations which is given for pitta diseases. Then Uluva. Uluva is actually a Malayalam word, but in literatures it will be mentioned as Uluva only for Vendayam, Trigonella phenumgricum. So even it comes in Arivagayaru also, right? So mostly Vendayam will not be mentioned in the literature. Uluva will be mentioned. Okay, then Kodiveli is also a very commonly mentioned one, and mostly Asans will use Senkodiveli more than that white one. Senkodiveli, Plumbago rubra will be much used. And this Plumbago rubra, it grows in little high altitude areas. This Plumbago auriculata, white and blue variety is seen in NIS also. Then Kanam, everyone knows.